Hey guys, it's Cupcake and I'm coming to you with my 1-year post-op vertical sleeve gastrectomy surgery video. I have filmed this. I've started to film this many times. I'm hoping that this is the one that I upload. There's just a lot to talk about and yeah, I even have notes, but I'm having a hard time like getting it all in and staying on track. So I'm gonna do my best. Anyway, if you haven't seen my other videos, I had vertical sleeve gastrectomy surgery January 26, 2017 in Salt Lake City, Utah. My highest weight was 296. My weight when I decided to have weight loss surgery was in the 260s. I had a 3-month supervised diet and got down to 239. And then my surgery weight was 234. My current weight is 154.8 pounds. I have been maintaining between 152 point something and 156 point something for the last 4 months. So I'm not really at goal, but I am maintaining my weight and I'm not really trying to lose weight at the moment. I do talk about that in other videos. I'm not sure how much of that, like I don't know how much of it I'll talk about in this video, so we'll see. Again, if you haven't seen my other videos, just a little bit about me. I am married. I have been married to my wonderful husband for 9.5 years. We have an 8, almost 9-year-old son. We have a half Himalayan, half Persian cat. And we have his name is Orson, and we have a little fawn pug named Gretchen. Orson is, let's see, he's about 6 years old, and Gretchen, I believe, is 3 years old. So that's our little family. Our son and our pug are in Arizona right now with my mother-in-law. We are planning to move to Arizona as soon as possible, but within the next 1.5 years. We did send our son down there for school. We were having some issues with school here, and then we sent our pug down to keep him company. So that's where we're at. I hate Salt Lake. My husband hates Salt Lake, and as soon as we can move to Arizona, we will be much happier. It is difficult to be away from our son, but we do talk to him over FaceTime and we see him as much as we can. Let's see, we saw him last April, and then I saw him in July, and I am going down to see him next month as well. So we're trying to make it work the best that we can until we can get moved down to Arizona. Also about me, my husband and I are polyfidelitous. That's like an offshoot of polyamory. Polyamory means multiple loves. Polyfidelitous is when you have more than one partner, but you have a closed relationship rather than an open relationship. So we are looking for another woman to love and be with and have a life and family with, for a triad. That is what we're working towards. So if you watch my videos, sometimes I will talk about those things. I am a bisexual woman. I have OCD, and anxiety and depression. So those are things that you will hear me talk about in my videos sometimes as well. I was diagnosed with OCD. I think it's been 2 years now since I was diagnosed with OCD, but it is something that I've been dealing with since I was a kid. I just wasn't diagnosed until 2 years ago, and that was a result of finally going to counseling, which I have also been doing for the last 2 years. So if you guys have any questions about any of those things, I may be able to answer them for you. Some things might be a little too private to share with strangers, but yeah, that's a little bit about me. Let's see. So think that I think I just talked about my stats. I'll tell you where I was size-wise. Prior to surgery, I was wearing a 14-16 in pants and an extra large or an extra large in shirts. I used to only really buy maternity shirts because they are long and fitted, and I liked my clothes fitted, so an extra large or an extra large was fitted on me. Same with the 14-16 in pants, and those are jeans. I always wear jeans with stretch in them, so those are the biggest sizes that I remember buying. I may have had a size 18 pair of pants at one point, but I don't remember for sure. But that's where I was prior to surgery. Bra wise, I was wearing a 46 triple D. So yeah. Now I am wearing between a size 2 and a size 6 pants. I have 2s, 4s, and 6, and one pair of 6s in my dresser, and it just depends on how much stretch they have in them. I have a lot of loose skin, so I need things that can stretch, and that's just how I like to wear my pants. I really only wear skinny leg pants that have stretch in them. But yeah, I wear between a size 2 and a size 6. Shirt wise, I wear between a size small and a size large. Medium is probably what fits me best on average, but I like fitted clothing, so I do wear smalls, and my larges are a little big on me. The shirt I'm wearing right now is an extra large in kids that I got at Target, and that's my new favorite place to shop, is in the kids section at Target, because a lot of the clothes are just a lot cuter and they're less expensive. So this is extra large in kids. It's just got this like little design and then gray on bottom. So yeah, bra size now, I am wearing a 36, and I wear like a D or a double D, it just depends. Or I wear like a small sports bra, or like I do have an extra small as well. The sports bras are kind of, for a while, that's all I was wanting to wear, because I feel like I spill out of regular bras a lot because of the loose skin. It's like I'm not really fitting into the cup size that I'm wearing, but at the same time, I can't really wear a smaller cup size because of the loose skin. So anyway, but yeah, I just feel like the sports bras are kind of like causing some strain on my shoulders and whatnot. So I decided to go back to wearing a regular bra and see if that helps. I've been getting a lot of headaches lately, and I think it's tension headaches, so I'm just having a lot of tension in my neck and shoulders, and it could be for multiple reasons. It could be stress, it could be my pillows, my bed, it could be the sports bras, and the way that I'm sitting, all of those things. I have a desk job. I work in a call center doing insurance authorizations, so sitting all day and in front of a computer, it's not very like good on my body. I've been there for 6.5 years. Also, again, if you have not seen my other videos, and in case you're wondering. So let's see. So why I decided to have surgery. I was pre-diabetic. I had insulin resistance, so my body wasn't using the insulin that it was creating. I had high blood pressure. My mom had heart disease when she died 10 years ago. She actually died from other causes, but she did have coronary artery disease when she died, so I have a predisposition for heart disease. I was tired all the time, headaches, didn't feel well, had no energy, and I was miserable. I really hated my body and where I was at. So it was all of those things. And then I had some coworkers. I've wanted to have bariatric surgery for a long time. I've been overweight for the majority of my life. But I had some coworkers that had weight loss surgery, so I found out they actually covered it, because in the past a lot of insurances did not cover it. Some insurances still do not cover it, but a lot of insurances do now cover weight loss surgery. So I talked to my husband about it. He was very supportive of me. And I had to go through a 3-month supervised diet. And I had to have a recommendation from my primary care doctor. Other than that, I already met the other requirements because of where I was at with my weight and my conditions, with the high blood pressure and the insulin resistance. I never thought that I would be able to afford surgery. I really just didn't. I always wanted to have surgery. Not always, but like for a long time now, I've wanted to have surgery. But I didn't think I could afford it. I raised my insurance up to the highest level, and they paid 80%. I also maxed out my flex spending to $2,500, and I had to pay my surgeon's office $1,700. I actually got some of it back because I overpaid, but I had to pay them $1,700 up front. So it made things really tight financially because my checks were a lot smaller. But I definitely would say that it was worth it. It was worth it, financially and otherwise. It's definitely the best decision that I've made for me. And I mean, it wasn't just for me. I really want to be around for my family as long as I can. And yeah, I'm so much better off now, health-wise, mentally, just so much better off than I was before. I have a lot more energy. Just everything about having had surgery is better, you know. I definitely deal with emotional eating still, but I can't eat as much as I used to be able to, which is good. You know, they take out, you know, between 70 and 80% of your stomach. And so, yeah, you're not able to eat as much. I have changed my diet otherwise. I focus on protein. I eat way less carbs than I used to, and obviously the amount of food that I eat is way less. I drink way more fluids than I ever did in the past. So yeah, I'm sorry if I'm repeating myself. I've filmed this video many times, like I said. But yeah, I don't have insulin resistance anymore, and I don't have high blood pressure anymore, so I don't need to take any medications for anything, which is nice, because I used to have to take a ton of medication, and I don't anymore. So my cholesterol is within a normal range, so that's really good. Let's see. As far as like complications from surgery, my surgery went as planned. I didn't really have any issues, except for after surgery, I found out I was allergic to the steri strips that they put over my incisions. So I got a very red, very itchy rash on my abdomen. I couldn't figure out what it was at first, until I ended up having to send a picture to the doctor, and he told me to take off the steri strips. And that helped. I also got a little bit of infection in my incisions. My doctor just called in some antibiotics. I couldn't swallow the pills, so they were capsules, and I had to empty them out, and that was disgusting. But I survived. So yeah, prior to surgery, surgery wise, there wasn't really any complications. I can tell you my night in the hospital was pretty awful. I had to stay over. The medication they were giving me, I think it was Dilaudid, kept causing my blood pressure to drop, and so then my alarm would go off constantly, and I didn't get any sleep. Um, it was just a really awful night. I had a really awful nurse the night that I stayed, so it wasn't a pleasant experience. It was really weird trying to eat afterwards. Like, it was just, the sensation is so weird trying to eat afterwards. But now it's pretty much like it used to be. I would say that my stomach is a lot noisier than it used to be. Um, and like, they tell you not to eat and drink together, but I do. I do a bit. Basically, I just kind of let my body tell me, um, you know, when I'm done, because I'll, like, when I try and drink after I'm full, like, I'll feel like a block, a wall, almost feeling like, oh, this isn't going down, there's no more can fit in there, kind of thing. Let's see. I have not thrown up since surgery at all. I did throw up prior to surgery. They give you the stuff to clean you out. You have to drink, and that made me throw up a lot. That is the last time that I've thrown up, and that was the night before surgery. It's just super, super salty. So yeah. I haven't thrown up. There have definitely been times where I've overeaten and made myself really nauseous, especially when I'm eating sweets. But I've been able to keep it down, and I haven't thrown up. I can tell you, prior to surgery, especially because I had my gallbladder out several years ago, about 8 years ago, I had my gallbladder out. 9 years. No, I guess it's been 9 or 10 years. Yeah. 9 or 10 years ago, I had my gallbladder out, and after that, I constantly dealt with diarrhea after eating, and that is hardly ever an issue for me anymore after having surgery. I did have a lot of issues with constipation in the beginning, and I just, like, I used Phillips, I've used like fiber drops and Fiber One bars and stuff like that. Now I don't really have an issue either way. I'm pretty regular. Sometimes I'll have diarrhea, sometimes I'll have constipation, but it's nothing too bad. So actually having surgery helped me a lot with diarrhea. I did have a little bit of reflux after surgery, so I did take some medication for that for a couple months, and then it wasn't necessary anymore. So yeah, like, I feel like eating now is pretty normal. It's pretty much like it used to be. I can eat anything. There really isn't anything that doesn't agree with me at this point. I just can't eat as much. Not even close to as much as I used to. I used to, before surgery, I could put away almost a whole large pizza myself. I probably could put away a whole large myself prior to surgery. But now, I can eat one piece of pizza, and then I might eat some toppings off of another slice, depending on how hungry I am and how big the pizza is and how many toppings there are. But yeah, I eat a whole lot less than I used to be able to. I wasn't able to eat a lot after surgery. That's the way it goes. For several months, I was not able to eat a lot. Now I feel like I eat pretty normal sizes. I eat between 4 and 8 ounces at a time. I am somebody that eats frequently. I do protein shakes pretty much every day. So yeah, and then, so I do that in the morning. I usually half my protein shake with water or with almond or cashew milk. That is one tip that I have for you if you're having a hard time getting protein shakes in, and you want to drink them, or it's recommended to you to drink them. Then I would try watering them down, or cashew or almond milk. It's a lot easier on my stomach to do that, and I also am getting in more fluids when I do that. You can also add it to coffee. I'm not a coffee drinker, so I've also added it to, like, hot chocolate. You could get like low calorie hot chocolate and add protein shake to that, if that's something that you like. So yeah, I do protein shakes. I do protein bars a lot. I do a lot of like prepackaged Lunchable type things, Lunchable brand, P3s, all those different things. I've done, I eat like 2 or 3 snacks a day. Those range from different things, like it could be boiled eggs, which hard boiled eggs is an excellent meal prep thing to do. It's super easy. I'm not much of a cook, but it is a super easy thing to do. It's a lot of protein, low in calories. I think a large egg only has like 70 calories, and it's delicious, so I do that a lot. Little bags of popcorn, occasionally little bags of chips. I might have that. I might have fruit, cheese, jerky, nuts, Fiber One bars, like the 90 calorie ones, protein bars, just anything like that. I will eat for snacks. Dinner varies a lot. We eat frozen pizza like once a week. We do eat fast food for dinner quite a bit. So my favorite thing is like bacon cheeseburgers. I just skip the bun. Depending on where I'm getting food from, I can eat like a double cheeseburger. Like McDonald's, I could eat a double cheeseburger. But if it's like a really big burger, like maybe a double quarter pounder for McDonald's, I might only be able to eat half of that without the bun. And then I do usually eat a few fries. So, you know, if I'm gonna have like some kind of taco variety, then I will try and eat insides of burritos, but I may eat some tortilla now. I make French toast like twice a month for my husband and and that is another really easy meal prep idea. I just make a whole loaf of I think it's Hillshire Farms cinnamon bread into French toast. I use heavy cream, eggs, obviously, vanilla, and brown sugar. That's just what I have at home. So I will do a whole loaf, and then we'll eat it for like breakfast or dinner with like some eggs and bacon. And then I pack the French toast for myself and my husband to eat during the week. It stays good for like 3 or 4 days after you cook it, maybe longer too, but that's just how long we'll eat it for, is 3 or 4 days. He eats his plain and I eat mine with peanut butter, you know, so I'll have that like leftover French toast for breakfast with like a scoop of peanut butter. So yeah, that's my other easy meal prep idea. Another one would be potatoes. A lot of bariatric surgery patients don't eat potatoes, but you could do regular potatoes, or you could do sweet potatoes. Just bake them in the oven, and then they're pretty good to eat later on. So those are my really simple, easy meal prep ideas. But yeah, so those are some of the things that I eat. I do eat dessert basically every night. I do have a sweet tooth. I eat a lot of Justin's peanut butter cups. Those are my favorite. I love ice cream. I love Enlightened ice cream. I haven't been buying a lot of it because I only can get it at Sprouts, and I don't really go to Sprouts for any other reason besides dessert, and so it's just kind of out of the way. Plus, Enlightened is like $5 a pint, so it's a little expensive, but I really do like Enlightened. I'm not a big fan of Halo Top. I will always go Enlightened over Halo Top. I don't really eat Halo Top anymore since I've had Enlightened. So I have tried some other brands of like low calorie ice cream, and Enlightened is definitely the way to go. No other brands really stack up to enlightened as far as like lower calorie ice cream. I do eat regular ice cream as well. Excuse me, it's kind of spitty. So yeah, I can down like half of a pint of ice cream still, because you know it's kind of liquidy. But yeah, it's just me. Not everybody, you know, eats dessert or whatever. I think we all like allow ourselves to have certain things and don't allow ourselves to have other things. So I'm definitely not saying eat the way that I eat. I'm just telling you how I eat. I'm just being honest with you about how I eat. And I do exercise a little bit. I've been doing strength training for about 10, maybe 15 minutes in the mornings, some mornings, not all mornings. And then sometimes I go for a walk on my lunch. When it's warmer, sometimes I like to jog. I kind of do intervals of jogging or sprinting and walking. So, yeah, I do that sometimes. That's my favorite way to get exercise. I take the stairs a lot, and I'm just overall a lot more active than I ever was in the past. I'm up and doing things a lot when I can be. Like I said, I do have a sedentary job, desk job, so I try and move as much as possible, especially because I have so much energy. It's hard to sit for long periods of time. It's also hard because I drink a lot of fluids and I need to use the bathroom all the time. Like fluid-wise, I drink a lot of water mixed with almond or cashew milk because I'm not a big water drinker. And so, yeah, I mix a little bit of that in my water, like 2/3 water to 1/3, or maybe half water, half, you know, almond or cashew milk. I get the unsweetened vanilla flavors. I've tried several brands that are good. Silk, Blue Diamond, and then I've been drinking Simple Truth lately. They're low in calories. It's like 25 or 30 calories per cup, so I drink a lot of that. I drink low calorie hot chocolate quite a bit. I drink protein shakes, my vanilla, protein shakes. I've tried lots of different kinds. Advantage is my favorite, and I find them the cheapest at Target, and they have like 100 calories. So the French vanilla, those are my favorite ones that I drink, but I drink a lot of other ones depending on what's on sale. I also mix those with water. I also drink a lot of tea, a lot of herbal tea, especially at work. So occasionally I might have a little bit of fruit punch or lemonade. I don't drink carbonated drinks. So yeah. Caffeine, I don't really do caffeine. I have a little bit just recently, but I don't do a lot of caffeine. I had a huge addiction to caffeine before surgery. I was drinking energy drinks, soda, tons of soda with caffeine in it, and then also a lot of green tea. And I just don't need it, and so I just don't really drink it. Alcohol wise, I've just recently started drinking alcohol again. I've only drank twice since I had surgery. Once a little bit of whiskey, like on New Year's Eve with my husband, and then we had some friends over to play board games, and I had maybe 3 shots of whiskey that I just chased with, I think it's a Bolt House vanilla chai, which I know has caffeine in it. That's like that's like the second time I've had caffeine drink wise since surgery, but yeah, I chased it with that. Alcohol wise, I get buzzed way quicker than I did before, just having a smaller stomach and being a smaller weight, so something to keep in mind. Straws, I do drink out of straws occasionally. I have these plastic cups that I got from Target that are reusable. I put my tea or my hot chocolate in those. And so I don't use straws that often, but occasionally I do use them. I do chew gum occasionally, but I'm more likely to like suck on a mint or a Tic Tac than chew gum. Let's see. I do have a lot of loose skin. I may have already talked about this, but yeah, I have a lot of loose skin in my arms. There's obviously still some fat in there, but it's a lot looser than it used to be. It's me trying to flex a little bit, but yeah. A lot of loose skin, a lot of loose skin in my belly, a lot of loose skin on my thighs, and a lot of loose skin on my breasts. So, yeah, it's just part of it. I would like to have skin removal surgery at some point in the future, especially on my belly and my arms, maybe on my thighs, and it would be nice to have like a lift, like a lower body lift as well. I have pretty much no ass since surgery. I'm working on it. I do a lot of butt exercises. When I'm doing my strength training, I'm focusing on my butt and my stomach and my arms. But yeah, I'm trying to get a butt. It is hard to build a butt when you're eating in a deficit, and I wouldn't say I'm really eating in a deficit. At this point, I'm eating enough calories to maintain and not really gain weight most of the time. If I see the scale going up, like it's a little bit up right now, then I try to adjust. Sometimes I try and adjust, and other times I'm just like, fuck it, I'm just going to eat what I want to. But yeah, if I see the scale going up, then I'll cut back a little bit on some things, maybe try and exercise a little more, and that's how I've been able to maintain my weight for the last 4 months. I am eating anywhere between like 13 and 1700 calories on average, definitely more around 1600 most days. I definitely go over that some days, and I may occasionally be under that, but not usually. I eat frequently throughout the day. I think I mentioned that. Some people just do like 2 meals and like a protein shake. Some people have 3 meals. I'm somebody that eats 3 meals and then also like 2 or 3 snacks and dessert. So I eat frequently. I think that that has actually been positive for my metabolism. That's just kind of my experience. Everybody's different. I have gone through a lot of stalls over the last year, and they suck. And you can either just keep doing what you're doing, or you can try something else. For me, when I've been in a stall, like I said, I wouldn't really call right now a stall because I'm not really trying to lose weight. Basically, I don't want the weight to come off of places that I don't want it to come off of, and you don't really get a lot of say-so where the weight comes off of. And I don't really want to eat less than I'm eating, and at this point I'm not really wanting to exercise more than I'm exercising, and so that's why I am where I am. And I'm pretty happy with where I'm at. I definitely have days where I still feel like I'm, over 200 pounds when I look in the mirror, and I have other days where I feel really thin. So it's just kind of a mindfuck thing that you just know that that's how it is. I mean, the days when I'm feeling really fat, I have to have some self-talk and just like, you're not though. So I need to get a full-length mirror at some point, and I think that will help, because only seeing like half of me up like at home or like in the mirrors at work definitely makes a difference. Sorry, I'm losing my voice a little bit because I've tried to film this so many times. Let's see. Anyway, stalls, increasing my calories in the past is what has helped me get through stalls. But if you're already at a place where if you eat more calories, you might actually gain weight, which you won't really know unless you try it. You know, and you can also do the calculations and whatnot, but they're not necessarily going to be accurate because they're just based on like your size and your height. So they may not be accurate to where your metabolism is actually at. But yeah, you might want to increase that. You might want to drink more fluids, and you might want to get more exercise, or if you're exercising a lot, you might want to cut back on the exercise. You might want to cut down on your carbs. You might want to eat less calories. It just really depends. You might want to eat more fiber. You want to make sure that you're using the bathroom enough. All of those things can affect your weight. Your weight is going to fluctuate every day. So just be aware of that. I wouldn't recommend weighing every day, especially when you get further out from surgery, because your weight does fluctuate, and you really shouldn't pay so much attention to the scale that it like ruins your day or whatever, because that's just not a good place to be. Yeah, let's see. I went with VSG, vertical sleeve gastrectomy, rather than the Roux-en-Y, because I didn't feel like I had that much weight to lose. I think I definitely was in denial. But the other reason is I was originally considering the lap band, but the lap band actually has started to erode some people's stomachs. And so when I heard that, my husband and I did some research on the vertical sleeve gastrectomy. Is the least invasive weight loss surgery that you can have at this point, at least that, the surgeon's office that I went to, that they were doing. So it has the lowest number of complications, and it's the least invasive. And so that's the one that I decided to go with, and I'm very happy with my decision. I have seen some people that have had the Roux-en-Y that have been dealing with complications. They definitely throw up a lot more. I mean, I haven't thrown up at all since surgery. I mean, it's definitely an individual thing, but I'm very happy that I went with the surgery I did. I'm trying to look at and see if there's anything else. I know this video has been kind of all over the place, but I feel like, I did talk about a lot of the things that I wanted to talk about. Definitely feel free to check out my other videos. I've been documenting my progress since I think a month out from surgery, so I do a lot of things like talking about what I eat, what I've eaten at different points that I was in a stall, mental health stuff, my periods, which have been a lot more irregular since surgery. Some of the things that I've gone through, like when I wasn't eating enough and I was feeling really dizzy a lot, passing out, changing doctors, hair loss. I've had a lot of hair loss, maybe not as much as some people, less than others, but I have had a good amount, to the point where I did cut my hair off. And right now I'm just trying to kind of grow out my pixie cut, so it's crazy in most of my videos. Vitamins wise, I just take Flintstones, like a Kroger brand Flintstones chewable. Right now I take 2 of those most days. Other than that, I'm not taking any vitamins right now. I'm always cold. That's something that you'll hear a lot from people who've had weight loss surgery, that we tend to be cold a lot. So yeah, anyway, check out my other videos. I talk about a lot of other things, over the past year. I do a lot of what I'm eating right now videos. If there's any specific things that you'd like to know more about, feel free to reach out to me. If you would like to follow me on Instagram, leave your Instagram name below, and I will check you out. I do have a private profile, so yeah, I can't think of anything else right now. And obviously, this video is probably one of the longest that I've had. But I just want to say thank you for watching my videos and for supporting me over the last year. This year has been like, it's been crazy. It's been one of the most life-changing years of my life. And I definitely would recommend weight loss surgery to anybody that was in a position like I was. It's definitely improved my health, physical health, mental health. It's been just a wonderful thing in my life, and I'm just really, really happy that I did it. You know, I was afraid to go through with it. I didn't think that I would be able to do all the things I needed to or be able to afford it, and it all got figured out, and it's all really been for the best. So yeah, anyway, if you have any questions, let me know, comments, let me know, and thank you to all my new and all my old subscribers and everybody in between. Thank you for supporting me and watching my videos, and yeah, just thank you very much, and hope to keep making videos for you guys, and for myself, because ultimately this is for me. Yeah, that's all I have right now, so I'll talk to you later.